Determinants of health and behavior. The objective of the lesson is to teach the students the determinants of health and behavior. Determinants of health and behaviors. 1. Biological determinants such as hunger, appetite, and taste. A. Hunger and satiety. Humans need energy and nutrients in order to survive and will respond to feelings of hunger and satiety. Different macronutrients have different effects on satiety. For example, fat is the least satiating, followed by carbohydrates then protein. In addition, low energy density diets have greater satiety than high energy density, e.g. high fat and or high sugar diets. B. Taste/palatability. The taste, smell, texture, and appearance of a food all impact on the palatability of a food. For example, sweet foods have a high sensory appeal and have higher palatability, meaning that the food may be consumed for pleasure rather than as a source of energy and nutrients. It is reported that the higher the palatability of a food, the higher the consumption. 2. Psychological determinants such as mood and stress. Stress can trigger changes in human behaviors that affect health. The effect of stress on food choice is complex and individualistic. Some people consume more food and make unhealthy food choices, and others consume less food. It is believed that stress-induced changes may be due to changes in motivation, e.g. reduced concern for weight control, physiological, reduced appetite, changes in eating opportunities, food availability, and meal preparation. Mood. Food can change an individual's temperament and mood and influences food choice. Individuals report food cravings, especially among women during the premenstrual phase, and the relationship with food for dieters mean that people may feel guilty. 3. Social support. Support from families, friends, and communities is associated with better health. Such social support networks could be very important in helping people solve problems and deal with adversity, as well as in maintaining a sense of mastery and control over life circumstances. The caring and respect that occurs in social relationships and the resulting sense of satisfaction and well-being seem to act as a buffer against health problems. 4. Income and social status. Health status improves at each step up the income and social hierarchy. High income determines living conditions such as safe housing and ability to buy sufficient good food. The healthiest populations are those in societies which are prosperous and have an equitable distribution of wealth. 5. Employment and working conditions. Unemployment, underemployment, stressful or unsafe work are associated with poorer health. People who have more control over their work circumstances and fewer stress-related demands of the job are healthier and often live longer than those in more stressful or riskier work and activities. 6. Education and literacy. Education is closely tied to socioeconomic status, and effective education for children and lifelong learning for adults are key contributors to health and prosperity for individuals and for the country. Education contributes to health and prosperity by equipping people with knowledge and skills for problem solving, and helps provide a sense of control and mastery over life circumstances. It increases opportunities for job and income security and job satisfaction. And it improves people's ability to access and understand information to help keep them healthy. 7. Social environments. A healthy lifestyle can be thought of as a broad description of people's behavior in 3 interrelated dimensions: individuals within their social environments, e.g. family, peers, community, and workplace, the relation between individuals and their social environment. Interventions to improve health through lifestyle choices can use comprehensive approaches that address health as a social or community issue. Social or community responses can add resources to an individual's repertoire of strategies to cope with changes and foster health. 8. Personal health practices and coping skills. Personal health practices and coping skills refer to those actions by which individuals can prevent diseases and promote self-care, cope with challenges, and develop self-reliance, solve problems, and make choices that enhance health. There is a growing recognition that personal life choices are greatly influenced by the socioeconomic and environment factors in which people live, learn, or work and play. Interventions that support the creation of supportive environments will enhance the capacity of individuals to make healthy lifestyle choices in a world where many choices are possible. 9. Health child development. The early experiences on brain development, school readiness, and health in later life have an effect on the health of the child as it develops. At the same time, the young person's development is greatly affected by his or her housing and neighborhood, family income and level of parents' education, access to nutritious foods and physical recreation, genetic makeup, and access to dental and medical care. 10. Biology and genetic endowment. The basic biology and organic makeup of the human body are a fundamental determinant of health. Genetic endowment provides an inherited predisposition to a wide range of individual responses that affect health status. Although socioeconomic and environmental factors are important determinants of overall health, in some circumstances genetic endowment appears to predispose certain individuals to particular diseases or health problems. 11. Gender. Gender refers to the array of society-determined roles, personality traits, attitudes, behaviors, values, relative power, and influence that society ascribes to the two sexes on a differential basis. Gendered norms influence the health system's practices and priorities. Many health issues are a function of gender-based social status or roles. For instances, men are more likely to die prematurely than women, largely as a result of heart disease, fatal unintentional injuries, cancer, and suicide. While women live longer than men, they are more likely to suffer depression, stress overload, often due to efforts to balance work and family life, chronic conditions such as arthritis and allergies, and injuries and death resulting from family violence. While overall cancer death rates for men have declined, they have remained persistently stubborn among women, mainly due to increases in lung cancer mortality. 12. Culture. Some persons or groups may face additional health risks due to a socio-economic environment, which is largely determined by dominant cultural values that contribute to the perpetuation of conditions such as marginalization, stigmatization, loss or devaluation of language and culture, and lack of access to culturally appropriate health care and services.